Hi, hello friends, good morning. Welcome to my channel, The Voice of Nurse. Today we are going to start a new subject from the nursing, medical surgical nursing point of view. We will discuss questions, very important, and previous years FAQ, frequently asked questions in previous years exams. Today we will discuss medical surgical nursing point of view, 30 questions. This is part 1 regarding medical surgical nursing point of view. 30 question we will discuss now. Previously we already discussed in previous videos in nursing point of view, nutrition subject, anatomy and physiology point of view 100 questions, and medical surgical nursing point of view 100 questions, and also fundamentals of nursing. These many subjects we already finished. This is the continuous video from the nursing subject. We are going to discuss today medical surgical nursing point of view, very important questions. Before moving on to topic, a small request friends. Anybody watching first time my channel, please subscribe my channel. Click on the bell icon for further notification. Please like a video. Let's move on to topic today. We are going to discuss medical surgical nursing point of view, very important. In part 1, the first question is, the Pulsus paradoxus is a sign of. We will see the options here. Option A, endocarditis. Option B, cardiac tamponade. Option C, angina. And option D, left ventricular failure. Here, what is pulse paradoxus? Pulse paradoxus is a phenomenon when your BP, blood pressure, is decreases with inhalation. When we are breathing in, that time our BP is going to down. That is called as pulsus paradoxus. The pulsus paradoxus is a sign that is inactivate of several conditions including the tamponade, cardiac tamponade, and chronic sleep apnea and obstructive lung diseases. These all are the conditions due to the pulsus paradoxus. Now we already seen what are the several conditions from the pulsus paradoxus. In these options, option B, cardiac tamponade, is the one of the sign of pulsus paradoxus. Next, move on to question number 2. Barrel chest can be seen in. The barrel chest can be seen in, we will see the options. Option A, chronic obstructive lung disease. Option B, normal imaging. Option C, tension pneumothorax. Option D, A and B. Here, what is barrel chest? Barrel chest, also called as thoracic arthritis. Here, thoracic arthritis is also known as barrel chest. When we will see in this barrel chest, the barrel chest happens when the lungs become overfilled with air like a balloon as they work harder. When one person is doing hard work, in that time air overfilled in the lungs is called as barrel chest. It look like a balloon shape. This can be happens most often because of a chronic lung diseases. The barrel chest indicates to, if one person is having barrel chest, means that it indicates to some of the lung conditions. Those are COPD, emphysema, cardiac failure, and osteoarthritis also. These all are the conditions due to the barrel chest. COPD means chronic obstructive pulmonary disease. Here in this question, barrel chest can be seen in option A and B. Chronic obstructive lung disease and normal image, we can see the barrel chest. No need of any diagnostic other than normal imaging. Next question, third one. Gas is also called as GAS. What is gas? Gas means general adaptation syndrome. This is one of the syndrome. GAS, general adaptation syndrome. We will see the options here. Option A, stress syndrome. Option B, pain syndrome. Option C, diarrheal syndrome. Option D, fever syndrome. Gas, general adaptation syndrome, describes the process your body goes through when you are exposed to any kind of stress. The stress is anything positive or negative. It has 3 stages. The gas syndrome, we are having 3 stages. General adaptation syndrome. First one is alarm syndrome. second one is resistance, and third one is exertion. Here the gas is due to the exposure of stress. So here option A, stress syndrome, is the correct answer. Next, move on to question number 4 here. The fourth question, normal value of cholesterol. Option A 60 to 80 mg for DL. Option B 100 to 200 mg for DL. Option C 135 to 145 mg for DL. Here option D, none of the above. The normal range of cholesterol is less than 200 mg is the correct here. Option B, total cholesterol level of less than 200 mg per DL is normal. In 200 to 239 is borderline high cholesterol levels in blood. 240, more than 240 is high cholesterol level. So the cholesterol will help show our heart disease risk, how much we are risk in heart diseases. Depending upon the cholesterol level, we can identify through the lab investigation. So here normal value of cholesterol is option B, 100 to 200 mg for DL is the correct answer. Next, move on to question number 5. ICCE refers to. What is ICCE? From the options, we will see here options. Option A, intracapsular canthus examination. Option B, intracooperative contract exertion. Option C, intercapsular cataract extraction. And option D, intracapsular cataract extraction. The options is similar. We have to observe what is intra, what is inter. The difference between intra and inter is both is different. So we have to observe the options first. Not only this question, any question we have to observe. Intracapsular cataract extraction. Option D is the correct answer here. ICCE is the removal of the lens and the surrounding lens capsule in the one piece in the eye. The lens is replaced with a artificial plastic lens. Here we can see in this picture the lens is removing and one piece of the lens removing procedure. Artificial plastic lens also replacement will be done in this intracapsular cataract extraction. ICCE we can see in cataract surgery cases. Here we can see in the first eye with cataract. Second picture is distilled lens is pulled out. The third picture is implant inserted, means the artificial lens. Then fourth picture is lens implanted into the position. Here we can see new lens in the eye. Next we will move on to question number 6. What is hyperemia? What is hyperemia? Option A, red eye. Option B, yellowish eye. Option C, infection. Option D, inflammation. The red eye means hyperemia. Erythmia is sometimes symptom of hyperemia. Erythmia is a sometimes symptom of hyperemia characterized by redness, swelling and other less visible reactions in the eye. Here hyperemia means option A, red eye is the correct answer. Hyperemia is a allergic inflammation or irritation in the eye. Next we will move on to question number 7. What is the action of mannitol? The action of mannitol. We will see here options. Option A, analgesics. Option B, antibiotics. Option C, osmotic diuretics. And option D, antifungal. Mannitol is a diuretic. It helps you make more urine and lose salt excessive from our body. It is treats, means mannitol treats swellings from heart and kidney and also liver diseases. Swelling around the brain and eyes we can decrease through the mannitol. The action of mannitol is osmotic diuretics. So here option C is the correct answer. Next we will move on to question number 8. Monilias. Monilias is caused by. We will see the options. Option A, bacteria. Option B, streptococcus. Option C, candida albicans. Option D, HIV. Candidias also called as monilias. What is monilias means? Also called as candidiasis. Here the candidias is also called as monilias, infection disease produced by the yeast like fungus Candida albicans. So here option C is correct answer, Candida albicans. It is a infection of the skin and or mucous membranes caused by the common yeast species of Candida. Not only the mucous membrane will infect in this condition, skin, intestine and mucous membrane and vagina also can be infected through the Monilias. So here option C, Candida albicans is the correct answer. Next we will move on to question number 9. A nurse is carrying a client after a bronchoscopy. Nurse is carrying a bronchoscopy patient and post-biopsy patient. Which of the following signs nurse should note? We will see here options. Option A, dry cough. Option B, hematuria. Option C, bronchospasm. And option D, all of the above. After finishing bronchoscopy and biopsy, the dry cough is common and normal. It is one of the normal post-biopsy cases. So option A is left. We will see here option B, hematuria, option C, bronchospasm, whether from the option 2, which one is correct. The client should be assessed for a signs of complication which would include means cyanosis, we have to monitor the patient, and also dyspnea and bronchospasm. So here option C is the correct answer, bronchospasm. Nurse should monitor and immediately inform to the physician bronchospasm cases. And also we have to monitor as a nurse bronchospasm cases. After the finishing of bronchospasm cases, nurse should monitor hypotension and tachycardia and any arrhythmias in the monitor. So here option C is the correct answer, bronchospasm. What is bronchospasm? Bronchospasm is a muscles that line bronchi tightening. What happens in bronchospasm means muscles that line bronchi is tightening the muscles. So here option C is the correct answer. Next we will move on to question number 10. 10th question is, what do you mean by maggots? What is the meaning of maggots? We will see here options. Option A, non-living foreign bodies. Option B, living foreign bodies. Option C, iatrogenic. And option D, none of the above. Here, what do you mean by maggots? Means maggots like a very small worm that is found in decaying meat and other foods. We will find the small worm in decaying meat and other foods. Later develops into the fly. These all look like a chini cream colored worms. So here living foreign bodies, option B is the correct answer. Maggots means living foreign bodies. Next move on to question number 11 here. Which of the following respiratory disorder is most common first 24 to 28 hours after the surgery? Which are the respiratory disorder post-op in the period of 24 to 28 hours of surgery? We will see here options. Option A, pneumonia. Option B, atelectasis. Option C, bronchitis. Option D, pneumothorax. Here option B, atelectasis is the correct answer. What is atelectasis? Atelectasis is a complete or partial collapse of the entire lung or area of the lung will collapse. The people will feel means the atelectasis when that happen, the people feel SOB. Suddenly they will develop shortness of breath. Atelectasis is develops when there is interference with the normal negative pressure that promotes lung expansion. Post-operative period, clients should be monitored closely. We have to observe the breathing pattern. Because of post-op period, they will feel congestion in the breathing pattern. Congestion due to the position of the patient. So here option B is the correct answer. Next move on to question number 12. Erythroplakin is diagnosed by. Erythroplakin is diagnosed by. We will see here option. Option A, biopsy. Option B, CBP means complete blood picture. Option C, ultrasound. Option D, CT scan. Here what is erythroplakin? Erythroplakin doesn't always cause pain or other symptoms in the condition often goes unnotified until your dentist discovers it during the routine oral examination only we can identify the erythroplakin. Mean that time doctor will advise a biopsy. Mean that time oral health examination time only they will identify and they will take a biopsy. Erythroplakin appears as abnormal red lesions on the mucous membranes in the mouth. So they will take a biopsy and they will send for a biopsy for diagnostic test for erythroplakin. Here option A is the correct answer. We can diagnose erythroplakin in biopsy. This is the one of the diagnostic test. Next move on to question number 13. Which of the following one of the cause to Meniere's disease? From the following option, one of the cause is Meniere's disease causing. So we will see here options. Option A, vitamin A deficiency. Option B, increased blood supply to the labyrinth. Option C, decreased blood supply to the labyrinth. And option D, none of the above. Here, the decreased blood supply to the labyrinth is the correct answer. Meniere's disease is a balance disorder caused by a abnormality in part the inner ear is called as labyrinth. So, the cause of the labyrinth, decreased blood supply to the labyrinth is cause of prolonged vertigo and hearing loss. Meniere's disease mainly characterized by dysfunctional of inner ear blood flow. So here option C is the correct answer. Decreased blood supply to the labyrinth is one of the cause of Meniere's disease. Next move on to question number 14. The 14th question is serum hepatitis is also known as. What is the serum hepatitis is also called as? Options: option A hepatitis C, option B hepatitis B, option C hepatitis A, and option D none of the above. Hepatitis B is also called as here serum hepatitis. Hepatitis B is a serious infection. Hepatitis B is a serious infection. It can lead to cirrhosis of liver. Hepatitis B spreads through the blood transfusion and sexual contact. The cirrhosis of liver or liver cancer which can cause severe illness and even death through the serum hepatitis. So here serum hepatitis is also called as hepatitis B. Hepatitis B is most common cause of hepatocellular carcinoma. So here option B is the correct answer. Next move on to question number 15. WHO initiated right to sight is name. What is the right to sight is name in WHO according to WHO? We'll see here options: Vision 2025, Vision 2020, Vision 2015, Vision 2030 means 2030. It was originally initiated by Sight First campaigning of Lions Club International Foundation in 2000 year. It has since been integrated into the Vision 2020. Option B is the correct answer. Vision 2020 and is coordinated by IABP in cooperation with the WHO. Here what is the IABP? IABP means International Agency for Prevention of Blindness. Through the coordination of IABP, the WHO has introduced right to sight. His name is Vision 2020. Next move on to question number 16. Which among the following food type is needed to restricted in a client with pancreatitis? The client is having pancreatitis, restricted food. We will see here options. Option A protein, option B carbohydrates, option C vitamins and minerals, option D fat. Restricted food for pancreatitis patient is fried foods and high fat food. Here option D fat is the correct answer. We have to restrict the client to avoid fat diet such as burgers, french fries can be problematic for people with the pancreatic patients. The pancreas helps with fat digestion, so foods with more fat make the pancreas works harder. Other example for fat diet, high fat diet, to avoid dairy products also they have to avoid. So here option D fat diet is the correct answer. Next, move on to question number 17. The 17th question is elaborative LEEP. LEEP. Elaborate LEEP. Options: option A, loop electrosurgical excision procedure. Option B, loop extra convulsive extrinsic port. Option C, light electroconvulsive extensive procedure. Option D, legal electrosurgical extension procedure. What is LEEP? LEEP is electrosurgical excision procedure. Option A is the correct answer. LEEP causes a wire loop heated by electric current to remove cells and tissues in women's lower genital tract. To diagnose and treat for a abnormal or cancerous conditions. The lower genital tract includes cervix and vagina. So here option A, loop electrosurgical excision procedure is the correct answer. LEEP means option A. Here we can see in this picture LEEP, loop electrical surgical excision procedure. Next, move on to question number 18. Increased use of laparoscopy leads to, we will see here options. Option A, dysmenorrhea. Option B, endometriosis. Option C, cancer of cervix. Option D, all of the above. Laparoscopy procedure aim to treat the infertility and structural causes of pain. As use of laparoscopy has increased, some cases of abdominal wall endometriosis and the port side have seen reported in the literature, and also endometriosis. Here, increased use of laparoscopy leads to endometriosis. Option B is the correct answer. Next, we will move on to question number 19. CML is characterized by the presence of which of the following chromosomes? CML is characterized by presence of which of the following chromosomes? What is CML? CML means chronic myeloid leukemia. So we will see here options. Option A, settled chromosomes. Option B, GPA6 chromosomes. Option C, leukopenia chromosomes. Option D, Philadelphia chromosomes. Here option D, Philadelphia chromosomes is the correct answer. Philadelphia chromosomes and is hallmark of chronic myeloid leukemia. Philadelphia chromosomes translocation is specific genetic abnormality in chromosomes, most common in childhood cancer. Acute lymphoblastic leukemia also one of the common, we can see the in children through the CML, chronic myeloid leukemia, due to the Philadelphia chromosomes. Here we can see in this Philadelphia chromosomes what will happen means then at 9th and 22 chromosomes will break or exchange will happen. So here option C is the correct answer. In this picture we can see Philadelphia chromosomes in the 9th and 22nd chromosomes are break or exchange is there. Next, move on to question number 20. Which of the following denotes a disease of heart muscles? From the following options, denotes of heart muscles, disease of heart. We will see here options. Option A, cardiomyopathy. Option B, myocardial infarction. Option C, CHF, congestive heart failure. Option D, pericarditis. Cardiomyopathy, group of disorders related to the heart is the correct answer here. Option A, cardiomyopathy is a general term for a diseases of heart muscles where the wall of the heart chambers have become stretched and thickened, and also stiffness of the heart muscles is there. Cardiomyopathy can lead to the heart failure, includes the dilatation of the heart and hypertonic heart diseases, and restrictive cardiomyopathy also one of the conditions in the cardiomyopathy. So here that denotes a disease of heart muscles is option A, cardiomyopathy is the correct answer. Next, move on to question number 21. What is aura? What is aura? We will see here options. Option A, warming of a impending seizures. Option B, post seizures. Option C, seizures. Option D, sign of seizures. Aura involves physical sensations such as changes in brain activity, tingling and numbness of the hands, and also dizziness. So here warming of a independent seizures is the correct answer. Warming of an impending seizures. Some people describe the warming they feel before they have tonic-clonic seizures, warming of impending seizures. So aura means warming of impending seizures. Option A is the correct answer. Next we will move on to question number 22. Which of the following is not a cause of risk factors for cardiac arrest? We will see here options. Option A, hyperkalemia. Option B, hyperglycemia. Option C, hypovolemia. And option D, hypoxia. Sudden unexpected loss of heart function leads to cardiac arrest. Not only loss of the heart function, loss of breathing and consciousness, these all are the causes for the cardiac arrest. The causes are irregular heart rhythm and ventricular fibrillation, severe hemorrhage, hypoxia, any heart diseases related to the heart, and congenital heart diseases, and also the age and family history related to congenital heart diseases. So here the following options, not a cause, is hyperglycemia. What is hyperglycemia? Hyperglycemia means higher than normal amount of glucose in blood, is a sign of diabetic mellitus and other conditions. Here cardiac arrest due to the risk factor of hyperglycemia. Next move on to question number 23. Inflammation of tissue surrounding the nail is known as option A, clubbing. Option B, koilonychia. Option C, onycholysis. Option D, paronychia. The infection is developed along the edges of fingernails or toenails is called as paronychia. Option D is the correct answer. Paronychia is a acute causes by a injury or irritation of the nails and bacterial infection, especially staphylococci, and also chronic causes is there mechanical or chemical factors. Fungal infection is the chronic causes for the paronychia. Here option D is the correct answer. But what is clubbing? Clubbing is a abnormal rounded shape of nail. We will see here option B. What is koilonychia? Koilonychia is also called as spoon nail. It is a disorder deficiency to the nutrient, deficiency of sufficient nutrient, and thin and soft shaped like little spoon-like structure is there in koilonychia nail. What is onycholysis? Onycholysis means nail separation from the nail bud. So here inflammation of tissue surrounding the nail is called as paronychia. Option D is the correct answer. Here in this picture we can see the inflammation tissue surrounding the nail is known as paronychia. Next move on to question number 24. Decerebration means what is decerebration? Options. Option A, normal body posture. Option B, abnormal body posture. Option C, involuntary body movement. Option D, seizures. The abnormal body posture is called as decerebration. Abnormal body posture. Option B is here correct answer. The decerebration that involves the arms and legs being held straight out, the toes being pointed downward, and head and neck being arched backward, means the abnormal body posture is there. In this picture we can see the abnormal body posture. Legs extended with feet internally rotated, arms extended with wrist rotated. This is the decerebration. Option B, decerebration means abnormal body posture. Next move on to question number 25. What is the method of test used to measure a intraocular fluid pressure? We will see here options. Option A, tonometry. Option B, slit lamp examination. Option C, ophthalmoscopy. And option D, none of the above. Tonometry is correct answer. Tonometry is a diagnostic test that measures intraocular pressure to determine the risk of glaucoma, and also normal eye pressure range is 10 to 21 mm of Hg. So here intraocular fluid pressure we will measure through the tonometry. Option A is the correct answer. Next move on to question number 26. Mast cell releases. Option A, vitamins. Option B, fluids. Option C, steroids. And option D, bradykinin, histamine and serotonin. Mast cells and basophils represents the most relevant source of histamine in the immune system. Mast cells releases bradykinin, serotonin and histamine. The serotonin is important role in the neurotransmitter. So here mast cell releases bradykinin, serotonin, histamine. Option D is the correct answer here. Next we will move on to question number 27. The 27th question, ventricular arrhythmia will be interpreted on the rhythm strip by primary analyzing the ventricular arrhythmia is there in the monitor. How we will identify the rhythm? The primary analyzing is, what is the rhythm? We have to identify from the options. Which rhythm means options? Option A T wave, option B P wave, option C QRS complex, option D PR interval. The ventricular arrhythmia are abnormal heart rhythms that makes the lower chambers of the heart twitches into the pump, means the decreased blood supply to the lower part of the lower chambers of the heart leads to abnormal rhythms. So here QRS complex is the analyzing strip for the abnormal rhythm. QRS complex, option C is the correct answer. The abnormal heart conditions are like ventricular tachycardia and atrial fibrillation and also VF. These all are the abnormal conditions in the heart due to the abnormal rhythms. So here ventricular arrhythmias means, so here primary analyzing the rhythm, ventricular arrhythmia rhythm is QRS complex. Option C is the correct answer. Next we will move on to 28th question. Increase in number of cells in a tissue is called as. The increasing in number of cells in a tissue is called as, we will see here options. Option A aplasia, option B hypertrophy, option C hyperplasia, option D hypoplasia. Before the discussion we will see what are these options. Aplasia. Aplasia means an organ, tissue or body didn't develop normally. So aplasia means this is aplasia. What is hypertrophy? Hypertrophy is result from the increasing the cell size. Next, what is hyperplasia? Hyperplasia means the increased number of cell in the tissue is called as hyperplasia. So here option C is the correct answer. What is hypoplasia? Hypoplasia means lack of cell in organ or tissue. So the lack of the cells in the organ or tissue is called as hypoplasia. In detail we will see here hyperplasia. Hyperplasia stems from an increased number of cells. Hyperplasia is an overgrowth of cells that lines lobules or ducts. It is not an cancer. Sometimes of cases hyperplasia linked with high risk developing the breast cancer and some of the cancers. So here option C is the correct answer. Next we will move on to question number 29. What is gout? What is the gout? We will see here options. Option A vascular disease, option B a degenerative disorder, option C renal disorder, option D metabolic disorder. Gout is a common and complex from a arthritis that can affect anyone. Anyone can affect the gout disorder. It is characterized by gout disorder is characterized by sudden severe attacks of pain, swelling, redness and tenderness in one or more joints in the body. Most often seen in the big toe is a common. So what is the gout means? It is a metabolic disorder is the correct answer. Option D. Here in this picture we can see the redness and swelling around the toe. Next move on to question number 30. The 30th question is last question in this video, part 1 video. A mysthenia gravis patient early symptoms. What is the early symptoms of mysthenia gravis patients? We will see here options. Option A paralysis, option B salivation, option C ptosis, Option D, dysphagia. What is myasthenia gravis? We have to know first. Myasthenia gravis is characterized by weakness and rapid fatigue of any of the muscles in the body. It is the under the voluntary movement. So here myasthenia gravis means we know now. What is the early symptoms of myasthenia gravis? Myasthenia gravis early symptoms are common symptoms like drooping eyelids, double vision, difficulty making facial expressions, and problems in chewing and difficulty swallowing. Drooping of one or both eyelids is called as ptosis. So here option C, ptosis is the correct answer. The drooping of one or both eyelids is correct answer. Option C. Ptosis is when the upper eyelid droops over the eye. Common symptoms are is drooping of eyelids. So here myasthenia gravis early symptoms is option C, ptosis. This is the last question in this video. We will continue from the 31st question in part 2. This is part 1 point of view medical surgical nursing. Next we will discuss continuous questions in the part 2 video. Thank you for watching the voice of nurse. Any questions, any doubts, please ask me in a comment section, comment box. Please like a video and share the video. Enjoy today. Thank you. Please subscribe my channel. Click on the bell icon for further notification.